So we're back on our webcast. Any thoughts that came to mind around assessment of learners being a catalyst either for health professions education or for system change?
It's clear that as we do assessments of learners, we tell learners what we think is most valuable. And I think that's a fundamental thing. And as we shift to thinking about how do we work in teams, how do we be more respectful in our communication and inclusive of patients and families and the diversity of cultures, that's a very powerful message. And so that I think that may reframe some of what we teach and how we teach in terms of, because actually it has to be embedded and connected. Assessment is essential.
So it could actually change the content in our curriculum.
Absolutely.
Yeah. John?
One of the responses I got back was from a midwifery educator who was talking about they're moving some of their education towards a team base, and in the process of they use something that's called a readiness assessment test. But you take the test first, and then you take the test as a team, and everybody discovers that they actually score better as a team than they scored by themselves, which gives a fundamental sort of feedback loop about the value of working in a team. And I think the more that we see, obviously, the practice of team work is going to be able to it'll shift the education process, but it's also the direction we need to be going with the system. Good direction.
Something in particular that comes to mind is actually the idea of values clarification, which is something that's becoming more and more important in assessment of especially medical students, but is used in the assessment of students around, and also can be used in the assessment of physicians around basically how to approach a patient about their set of values, what they want out of an encounter, what they want out of their medical care, and especially where the real value of the tool is where those values might conflict with what the physician might actually want out of that encounter. And so in the sense of using values clarification as an assessment tool, but also as a way to kind of change the way we teach, is that, what you were saying earlier about ambiguity, and medicine is all about ambiguity. We have to discover what it is that the person in front of us, as, if we're the provider, what the person in front of us wants out of their encounter. And if, we end up, for whatever reason being that patient, sometimes what we want as a patient is very different from what we want as a physician. And understanding the kind of tension there, and also a way to navigate around it. So I think that is a very good tool.
I was thinking also this morning about the phrase of assessment driving learning, and it reminded me when we started very early on in our interprofessional education journey around an IPE curriculum at the University of Toronto, that we started to find that education was actually driving practice. So as our interprofessional groups of students were entering clinical environments, the practicing clinicians started to say, well, if the students are learning that way, why is it that we don't actually do that? Why don't we use those models in practice? And I wonder whether the same analogy might be true for assessment. So as we start to build team assessments from the student perspective, I'm curious about what that will actually do in terms of changing healthcare practice or the healthcare system in terms of how assessment is taken up. And I think we're starting to see that already in things like how practitioners are reviewed in terms of their performance through human resource departments, where there is an increasing emphasis on team assessment. And also at the clinical level, and I'm thinking particularly in hospitals, because that's where I work mostly, where we're starting to see assessments about, what is that clinical unit scorecard that the whole team contributes to as opposed to the individual professional. And so I do wonder if it's not just about education driving practice, but does assessment have the opportunity to change what hospitals and community centers and other practice environments actually look at?
And I think the overlap there is in terms of health profession educators, because as we change what it is we want to do with assessment, we have to increase our faculty development and help re-educate the educators to really look at working as a team, and if they are carrying over their work into practice, that you have that, in some sense, learning drift in terms of competencies. What do we value in terms of competencies of our providers as team members and working as in terms of outcomes of teams? And so, I do think that it's really interplay. In the same way, though, in some settings, it may be the health system that will drive change. And so I don't want to be Pollyannish and think that the academic towers of expertise are going to drive the healthcare system. But in fact, I think we have to be very realistic and recognize that as healthcare systems are looking for better outcomes, the health systems are actually going to be driving a lot of our interprofessional change.
I think that's fair, and I agree with you. The faculty development need is huge, and we heard that this morning just within single professions. I would imagine the challenges of faculty assessment around team assessment is even more challenging. And I'm not sure who's doing that really well. I'm struggling to think of exemplars in that regard.
I know of a very interesting process I came across in my call out to our groups was at Pacific College of Oriental Medicine. There's an educator there named Stacy Gomes who took all of the competencies, the IPEC competencies, and in the course of their accreditation application, she went through all of their measures that they've been using historically and measured those against those competencies, and some actually that we'd added through our academic consortium that we thought were important for our field, but to drive actually all of what they're trying to capture, which would then be driving what the teachers need to be teaching to. A very interesting other example that was, I think, in terms of changing health system behavior, was it's an instrument that's out there. It's a naturopathic doctor named Ryan Bradley said he uses what's called the 5 A's from the it's the U.S. Preventive Services Task Force. Do you know that structure there? I mean, it's a very interesting basic assessment method and practice method for working with lifestyle change issues, and it's a structured method for doing it. And if you would think what would happen to practice if every primary care encounter that involved some form of chronic condition that was lifestyle related had somebody, not only assessing, and giving information, but also coming up with a buy-in, the acceptance, the agreement, right, and then the follow-up plan. I mean, they're what assess, advise, agree, assist, and arrange, right? So it's an interesting tool set out there that would be a tremendous change in the health system.
I was going to suggest that as we think about the future, thinking about what are some of the core aspects that should be a part of assessment that are not simply viewed as building blocks that are dropped, but rather that, as a discussion earlier in the large group talked about safety, that are essential for safety, that would be foundational, carried throughout. And so communication as a team functioning, reflective teams, looking at safety, effective use of the best evidence, working together. I would love to see us get to a point where we kind of think in terms of core interprofessional competencies that become alive in curriculum and assessments and are standard throughout, so that, yes, maybe you raise to a higher level of clinical reasoning, but if you don't manage to achieve those foundational aspects that are core, then you don't really get a pass. You have to continue to be communicative and team-focused in your outcomes.
So I think we'll pause there and take you back to the report out.